Okay, so here I am. I'm going to do a quick video on the progress of my wound. Mainly this video session is for me to document the progression of my wound. I thought that in the meantime I could give tips, tell people what I'm feeling, what I'm going through. Hopefully it'll help somebody if they're going through something similar. So what I thought was it'd be a good idea to give like my top tips on how to deal with it and the best way to cope with having an umbilical hernia repair. I know everybody's situation is unique, but I kind of feel like mine's normal. I don't feel like it's anything that's abnormal. So the first thing that I'd say, as far as one of the biggest tips I could give you, is if you get an umbilical hernia, and even if no matter how small it is, I personally recommend that you you talk to your doctor about repairing it. My doctor talked me out of repairing it. At first he said that it's just cosmetic, that it won't hurt me as long as it didn't become strangulated, it wouldn't be an issue. And I'm sure that's true, but I don't personally know of anybody that I've talked to with hernia, and I've networked with a lot of people. I speak with people online about it. I don't know of anybody whose hernia went away or didn't get worse. So the likeliness is mine started as the smallest little bulb inside of my belly button. And I remember I even felt it when it happened. I thought it was just a pain, but then I noticed there's a little bulb and it just got bigger and bigger. Over the course of about 2 years, it went from a little bitty pooch to my entire belly button was full to the latest picture. I don't know if you've seen it. I don't think I even posted it. But I can show you a picture. I can send a picture, link it maybe into this video if I can figure that out. But it was huge. I mean, literally the size of a plum of a mass coming out of my belly button. So they're going to get worse. I don't think that if there's problems associated with mesh. I had to get mesh because mine was like this big. So I had to get mesh. But if you start off small, they can probably go in there and suture that up, and it can just be no mesh and no foreign bodies and reduce your risk of having an infection or an issue go wrong. So number one, get it repaired. Talk to a doctor that's competent. Talk to a doctor that's with you with that idea. And because my doctor at the time, I'm not going to say who he was, but he was like, "Hey Chris, if we say that it's killing you, we can do the operation." But I was personally like, "Yeah, no, it's going to get better. You know, you said it's going to get better, and I believe that I can make it get better." You know, I had that like false sense of I'm awesome and I can make things work and I'll heal fast and all this stuff. It's just nonsense. It's going to get worse. So number two, huge. No, these aren't in particular order, by the way. But number two, definitely use a stool softener. I would say 2 to 3 days before your surgery, do a stool softener. And then continue. I'm still using them. I'm on day 10 right now, and I'm still using a little bit of stool softener per day, because you don't want to strain. I mean, the whole reason I know how I caused mine, and mine was because I was extremely constipated, and I was straining my ass off. And believe it or not, that caused that hernia. I strained that hard. So use the stool softener because you do not want to strain. That's the risk of rupturing the wound that he just repaired, or she. And when you're on the toilet and you need to use the bathroom, straining hurts like hell. I mean, it hurts bad. So don't minimize the importance of having a stool softener. I know it's gross, but it's so important. Number three would be every time you have to contract your ab, every time you have to contract your core, put pressure on it, or put like counter pressure or a pillow. I don't need a pillow. I'm so fat in the gut that I can use my fat as a cushion. But I would cuddle my arms around like kind of like this. I don't know if you can see it. I would just do this and push in on both sides, and it provides enough support so that that wall's not trying to come out too much. You don't want to just free cough or free laugh or free hiccup or whatever it is, or if you're on the toilet or if you need to sneeze. That it kills you. Number 4, I don't know which one I'm on. Number 4, I guess. You need to be bedridden. Like you need to walk. You definitely need to get up and move around and walk. But you don't need to have any chores planned. Honestly, I would say you need to be off work or school for 10 days. Because this is day 10 and I feel really, really well at this point. It's been a little uncomfortable, but I think right now, honestly, I could resume my job because I don't have an active physical job, and I don't think it'd be a problem. So I recommend 10 days of recovery, and definitely no less than 7, because I was still feeling pretty shitty up to day 7. But you'll have enough of you want that wound to heal. You don't want to be stressing it at all. So 10 days of rest, and you definitely want to get up. So this goes to my next point. I don't know what number on 5, I guess. You want to walk. So number 5, get up and walk. You want to walk, you want to move around, you want to get upright, you want to stretch the wound. You don't want to always be in a contracted state, because you want to put it into a mode where it's going to be flexible. You don't want it to scar or heal in a locked in position where you feel, where it won't move. Like right now, I feel like I can extend back and I don't really feel pressure on that. And I think it's because I vigilantly did that every day. I recommend, if you do walk outside. If you can walk barefoot. I won't go into the reason why, but it's good for you. Sunlight, get some sunlight. It's all good for you. Drink plenty of water. Your body is fighting off infection. It sees that mesh as a foreign body. You want to drink lots and lots of water. In the same vein, point number 6, I guess, try to eat whole plant-based foods if you can. I'm not saying you need to go vegan, you need to go vegetarian, but during this healing phase, meat, animal protein, milk, things like that put a little bit more stress on your body to digest, and plant goes down so easy. So you're making it easy on your body so that it can use more of its energy to heal. I feel like it's paramount to do that, because you're in a critical stage where it can get infected. You want your body to have as much strength as it can possibly have to fight off infections, to heal itself, and to prevent things from going bad. So drink lots of water, eat plenty of plant food, and plus when you go to the bathroom, it's easier. It's so much easier if you've had plant to use the bathroom. Trust me, it smells not as bad. TMI, I'm sure. But anyways, I don't know if that's all the tips. Those are the big ones, though. Have enough rest. Plan on the first 3 days doing hardly anything. I mean, the first 3 days, just getting out of bed to go eat, and getting out of bed to go to the bathroom, and getting out of bed to make a small little walk around my house was enough. Like I've got a trailer. I got a 16 by 80 trailer, and I just walked to the end of it and back, not even outside, the first 3 days, because that's all I could do. I was so tired. So after day 4, I started feeling more energy, and like I could do a little more. And like by day 7 now, I'm back to where I feel, I mean, it's day 10 for me, but by day 7, I felt pretty normal. But it wasn't until then, for sure. So I know this video is longer than a short video, but I'm going to document the wound real quick, and then I'm going to cut this video off. But those are definitely the biggest tips that I could think of at the moment. Here's the wound. It's definitely, I still have that hard part. That's not going away anytime soon. We need to see the surgeon and see what needs to be done about it, if anything. Maybe it'll just go away. You can see all the bruising that's starting to leak down, but the wound itself looks pretty good. The inside wound, this suture up here inside in the upper lid, the glue came out last night actually, so I put a little bit of antibiotic ointment on it. But the glue on the top part, you can see, has been crusting off. When it flakes off too much, I've actually been using fingernail clippers to sterilize them and clip the excess glue off so it doesn't bind to my shirt or anything and rip. It's the last thing you want. Just be gentle with yourself. Allow yourself to heal. Don't push it. Even men think that they can do things too early. We think we're tough and shit like that, which we are tough, but not whenever you're healing from abdominal surgery. So good luck with your surgery. If I think of any more tips, I'll post in the second one or whatever. Have a great one.